5 minutes. Thanks for being here. All right. Hello, everybody. Welcome to Advancing Prosecutor-led Behavioral Health Diversion. I see the numbers popping up, so we'll just give 1 or 2 more minutes for folks to sign in, but please get yourself comfortable. We are about to start. All righty, I think we have a lot to cover in our time together, so I'm going to get started. Good morning if you're also joining from the West Coast. Good afternoon to those of you further east. Thank you for joining us today for our webinar on advancing prosecutor-led behavioral health diversion. My name is Hallie Fader-Tau. I'm a program director at the Council of State Governments Justice Center, and I'll be moderating today's webinar, which is hosted by the CSG Justice Center with support from the Bureau of Justice Assistance at the U.S. Department of Justice and provided in partnership with the Association of Prosecuting Attorneys. Before we get into the webinar today, I will just do a little bit of housekeeping. Anytime during the webinar, you can ask a question by typing it into the Q&A box on the bottom right-hand portion of your screen. For content-related questions, we will keep a running list and address them all at the end of the webinar during our Q&A session. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239, and that number is also in the chat box. Please understand that there are some technical issues that you may not be able to resolve during the webinar, and for this reason, we're recording the webinar and we will post it on our website by the end of next week. On today's webinar, we're going to do some introductions to ourselves at the CSG Justice Center, the JMHCP program that's bringing us today's event, and the Bureau of Justice Assistance, our sponsor for today's programming. We will talk to you about work being done around behavioral health diversion and introduce you to our speakers. Today's speakers will describe their own work and some of the unique benefits and challenges to developing prosecutor-led behavioral health diversion programs. Presenters will also discuss best practices in program implementation, such as developing eligibility standards, establishing candidate screening protocols, and setting treatment conditions. Again, if you have any questions during the webinar, we encourage you to include them in the Q&A box so that we can address them during the Q&A session at the end. As I mentioned, I'm coming to you from the Council of State Governments Justice Center, which is hosting this webinar. CSG is a national nonprofit nonpartisan membership association that serves policymakers at the local, state, and federal levels. We provide practical, nonpartisan advice based on using evidence-based and consensus-driven strategies to increase public safety and strengthen communities. As an organization, we focus on a range of goals within the justice system, including breaking the cycle of incarceration, improving health, opportunity, and equity, and improving public safety. The Justice and Mental Health Collaboration Program, which is a federal program that is bringing us today's webinar, it promotes innovative cross-system collaboration to improve public safety responses and outcomes for individuals with mental illnesses or co-occurring mental illness and substance use disorders who come in contact with the criminal justice system. As you'll hear discussed today, as we're talking about prosecutor-led diversion, the JMHCP program is really about the partnership between criminal justice and behavioral health stakeholders and working together to improve outcomes for people who, with behavioral health needs, who are involved with the criminal justice system. The JMHCP program is administered by the Bureau of Justice Assistance at the U.S. Department of Justice. We appreciate their sponsorship of this program and their work with the JMHCP grantees, as well as sponsoring events like this that bring knowledge and peer experience across the field. At the Justice Center, we have been working for a while on behavioral health diversion interventions. As many of you know, diversion is a very common word in the criminal justice policy conversations now, and we realized that there was a great need to clarify what does diversion mean, what are different types of diversion, and so we worked based on our experience with the Justice and Mental Health Collaboration Program grantees, as well as others across the field, to develop a publication, Behavioral Health Diversion Interventions, moving from individual programs to a system-wide strategy. And that's the publication with the blue and green and yellow V on the left of your screen. We also developed a pair of fact sheets on jail-based diversion and court-based diversion for those of you who are interested in how those programs are set up and frequently asked questions about developing those programs or their rationale. Today's program is part of our behavioral health diversion work. We wanted to spotlight the role that prosecutors can play in leading and fostering diversion programs. So we have a great group for you today. As I mentioned, I'm Hallie Fader-Tao. I'm a program director at the Justice Center, and I lead our courts and behavioral health work. I'm thrilled to be co-presenting today with Bob Hood, who's a project director at the Association of Prosecuting Attorneys. Bob has been the director of Community Prosecution and Violent Crime Division at the APA since 2011. In that position, he has managed 3 Department of Justice training and technical assistant grant programs, including the Prosecutor-led Diversion, High Performance Prosecution, and Prosecutorial Leadership programs. He also played an important role in the formation of the Seattle Municipal Court's Mental Health Court and expanding that office's efforts on diversion programming. He has over 38 years of prosecutorial experience. So we have identified today a number of other prosecutors who are doing prosecutor-led diversion work now, going alphabetically on the top of the slide. Jeff Altenberg is the Deputy District Attorney in Milwaukee County, Wisconsin. Jeff was sworn in this position in 1997. Prior to becoming one of the first assistant district attorneys in Milwaukee to serve as a community prosecutor in 2002, he served as a prosecutor in the Milwaukee County District Attorney's Drug, Domestic Violence, and General Misdemeanor Units. In 2007, the Wisconsin District Attorneys Association named Jeff the Assistant District Attorney of the Year in the state in recognition of his work with community prosecution and alternatives to incarceration. Next, alphabetically, we are joined by Scott Ellington, who was elected to the office of District Prosecuting Attorney for the Second Judicial District of Arkansas in May 2010 and was sworn in January 2011. He is in his 9th year of office. During his time as district prosecuting attorney, Scott was instrumental in the formation of several specialty courts, including mental health court, veterans court, juvenile drug court, sobriety court, and the expansion of drug court into additional counties in the district. He was elected as the Division 12 Circuit Judge of the Second Judicial District in March 2020 and will be sworn in January. Finally, alphabetically, but by no means least, Kent Lovern is the Chief Deputy District Attorney for Milwaukee County. He oversees the administration of an office comprising 125 attorneys and 150 support staff. Kent, we're really happy you made time for us today. He also oversees several crime prevention collaborations between the District Attorney's Office and community partners. So I will turn it over now to Bob to share a little bit about the Association of Prosecuting Attorneys and their work on prosecutor-led diversion before we go into a discussion with our panelists. So Bob, can I hand it over to you?
You can. And then thank you, Hallie, for your introduction. And thank you also for playing such a critical role in bringing This collaboration that we've had over the last part of this year to actually expand the prosecutor-led diversion toolkit. As we've learned in doing this kind of programming, cross-system collaboration leads to great things. And thank you for reaching out to us, and thank you for your help in further developing the toolkit. APA itself is a national association dedicated to supporting and enhancing the effectiveness of prosecutors in their efforts to ensure justice and create safer communities. And we've been around for a good part of a decade. Essentially, we're a prosecutorial think tank located in Washington, D.C., but most of our work really is about helping prosecutors and their law enforcement and judicial partners at the local level. Over the last decade, we've been involved in several training and technical assistance efforts funded by the U.S. Department of Justice, and in some cases, private foundations. And one of those efforts that I was particularly involved in as a program and grant manager was the Prosecutor-led Diversion Training and Technical Assistance Grant Program. Surprisingly, even though diversion has been around for better than 4 decades, I don't think from a national perspective, we had a good feel for what was really going on in diversion. And as a result, the National Institute of Justice created a research project to try to figure out what was going on in prosecutor diversion and what were the kinds of outcomes that were happening. So I had the good fortune to work in conjunction with a team that was led by the Center for Court Innovation and in essence produced the first National Institute of Justice study on prosecutor-led diversion. I've had a long interest in this subject. Going back to the start of my career, I suppose I spent a lot of time in prosecution and trying to figure out ways of holding individuals accountable and essentially using criminal justice and convictions to try to intervene in the course of their lives. Towards the latter half of my career, I've spent more time trying to figure out ways to avoid convictions for individuals when it's appropriate and when we can actually get better outcomes than just using traditional criminal justice. APA, even after the end of the prosecutor-led diversion grant training and technical assistance program in 2018, has continued to provide assistance to prosecutors nationwide on diversion. We've also continued to maintain the prosecutor-led diversion toolkit that we'll talk about in just a minute. It's an online resource to essentially quick start prosecutorial efforts at developing new programming. We can go to the next slide. We've added this chart, which is the diversion sequential intercept model. Some of you may have seen this before. What this chart is trying to identify is that as someone goes from an incident that leads to their contact with the police to the end of the criminal justice process, there are a number of intercepts that present opportunities for police, prosecutors, and courts to do things the way they normally do in the criminal justice process, or actually shift gears and divert individuals out of the criminal justice system. And so many of you in our audience might be familiar with this idea of law enforcement assisted diversion. That's where decisions are made literally at the point of contact, perhaps at the point of arrest, by law enforcement to, rather than send an individual straight into jail and the criminal justice process, shift them to community-based treatment. Law enforcement assisted diversion actually started in my hometown of Seattle. It has now spread to a number of places across the country and literally around the world. Also included within that notion, I believe, is the idea of crisis intervention teams. So Memphis, I believe, was the first jurisdiction that started a good number of decades back, but that now is also an approach. So it's this idea that just because you have a criminal episode doesn't mean that you necessarily have to trigger the criminal justice process immediately. Prosecutor-led diversion happens in the next stage of the criminal justice process, either after the police have handed the case off to the prosecutor for a filing decision or after the prosecutor has made that decision. So we have what we call pre-filing diversion by a prosecutor and post-filing diversion. That happens at a point where the prosecutor still has pretty much sole control over decision-making on an offender. And then finally, after we saw the spread of prosecutor-led diversion, legislatures and courts began to codify the practice, and we saw, particularly between 1980 and 2010 or so, this rise of court-led diversion that many of you are probably familiar with. The other thing to say, there are gray zones behind these. This chart really is trying to illustrate the differences between the various functionaries within criminal justice, but there's a lot of cross-system cooperation that goes on and some graying on the margins as you go from one step to the other. Next slide, please. So why is prosecutor-led behavioral health diversion important? When I was with the city of Seattle, we were involved in the creation of, I believe, the third mental health court in the country. And we learned a lot about trying to deal with people with serious or significant mental illness in the system. But we also learned that there were opportunities to intervene much earlier, and we tried to develop diversion programming that would identify these individuals and remove them from the system, as long as we were satisfied that public safety interests were considered and that we could get a better outcome from that process than the traditional criminal justice system. What we've learned, I think, from the national level, from the National Institute of Justice Study, is treatment, behavioral health treatment, can reduce recidivism and improve public safety. And that's a critical thing. If we can get a better outcome from actually diverting an individual to treatment, it doesn't make sense to put them through a criminal justice process that might only exacerbate the likelihood of their recidivating at a later point. Second thing, diversion efforts can address health and justice inequities, and there's some reference materials at the end of the webinar you can take a look at for those propositions. But I think it's pretty clear that issues of race and of health services and mental health treatment services, they are not equally available to everyone in our society. And diversion is a means to try to be aware of and address some of those inequities. Third, prosecutors can play an important role in helping people improve their lives and send them on a path to treatment and recovery, and sometimes much earlier than other members or partners in the criminal justice system. We all know how long criminal justice processing takes. It's expensive, it's time-consuming. Oftentimes, a person doesn't get to the point of referral to treatment to much later than when the actual incident happens. Jail is not the best place to treat people who have behavioral health issues, and time is the enemy. So prosecutors can play an important role in helping move that along. And finally, you can save money. Everyone knows in some instances in Seattle, we were paying $175 just to book an individual. We were paying, I think, $123 the last time I saw numbers when I was with the city, a day for keeping people in custody. If you can move them into the community, treat them safely and effectively, those efforts can save that correction time and allow you to reinvest it in the kinds of services and programs you need to accomplish that. I believe that's it for me for the moment, Allie. I should just mention, we've talked about the toolkit. It is available at the website that's listed. I think it's actually hyperlinked into the program, but at any rate, if you copy that or hit the hyperlink, it'll take you to the page. The getting started is where you should start if you're thinking about developing one of these programs. You'll end up with a menu that includes program planning and implementation and resources. And very shortly, that tab is going to include a tab specifically dedicated to behavioral health diversion programming. And that's part of the collaboration we've worked with CSG on providing those materials. Next slide.
Great. Thank you, Bob, for giving us such a short but thorough background and foundation on prosecutor-led behavioral health diversion. We're going to move now into what is, I guess, a virtual roundtable conversation with the prosecutors from Milwaukee County, as well as Mr. Ellington from the Second Judicial District of Arkansas, about how they've applied prosecutor-led diversion in their very different communities. And we'll be calling back on Bob in a number of these questions to add in both from his own experience in Seattle as well as the national perspective from all of the work APA has been doing over the last number of years on prosecutor-led diversions. So I'm going to turn first to Jeff and Kent to tell us a little bit about Milwaukee County in Wisconsin. I'm going to ask them both to introduce themselves, tell us a little bit about Milwaukee, and if they can talk a little bit about the prosecutor-led initiatives underway in Milwaukee County, that would be great as well. So turning over to Jeff and Kent.
So this is Jeff Altenberg. I am a deputy DA in Milwaukee. I'm going to allow my chief deputy to talk a little bit about Milwaukee, our community in general. What I will tell you is that our prosecution-led diversion program kind of spans all the major areas of our office. Our program, called the Milwaukee County Early Intervention Program, is a risk-based, evidence-based program. We use a number of different tools, risk assessments that we'll talk about a little later, to try to assess people's short-term and longer-term risk to reoffend, and that helps us make determinations about who we might be able to put into the pre-charge diversion program. And in Milwaukee, diversion is a term of art. So diversion means anybody that we decide to enter an agreement with pre-charge, and post-charge deferred prosecution is used for those that tend to be moderate or moderate to high risk. So we have a diversion, a DPA, a drug treatment court, a veterans treatment court. We have a day reporting center, and we use these tools to try to determine which pocket individuals fit into. Overall, the main target population are those that are engaging in nonviolent misdemeanors or felonies, low to moderate to moderate high. Exclusions are offenses that involve firearms, use of firearms, felony level sex offenses, or injury resulting in great bodily harm. And of course, we consult with any victim involved in these cases, and they help us make determinations about whether individuals are appropriate for any of these programs. So I'll turn it over to Kent to talk a little bit more about our community and this program.
Thanks, Jeff. Well, as you can see, the population of Milwaukee is nearly 1 million people in our county, and we're entirely urban in Milwaukee County. I would say that we have a lot of assets that make us a very desirable place to live. We also are dealing with a lot of wrong decision-making over the lifespan of the city. Many other cities, we're a highly segregated city racially. We're very diverse, but highly segregated, one of the most in the country, unfortunately. And a lot of the disparities in our community cut right along those racial lines as well. So we have a number of people in our county who are thriving economically and from an education standpoint, and we have a large segment of people in our county that have no access to or have very little access to healthcare and to employment and to the educational opportunities that we all should have. So we're dealing with that, and that's a very real struggle in our city right now and in our larger county as well. I would say that our philosophy from our office has been, for the 14 years that Jeff and I have worked for John Chisholm, our elected DA, our philosophy has been coming into the office prior to that time as formerly as line prosecutors, similar to what we heard Bob say, was to move from doing what we were always traditionally doing as prosecutors and responding to people's transgressions and try to develop more strategies engaging the community around identifying the root causes of what brings people into our systems, and that includes economic and educational and other issues that impact our entire county. And so that has been a lot of the philosophy driving the work of our office over the last 14 years in an effort to make our community safer, make it more aware of how we can better make it a safer, more healthy community overall for everyone. And Jeff has really been the architect of all of these programs that have been laid out here, and that we'll talk about a little bit more. Jeff has really been the designer of, and so we appreciate again the opportunity to be with you here today.
Great, thank you both, and thanks for the pitch from Milwaukee. We'll move over to a very different set of communities in the Second Judicial District of Arkansas, which is also a Justice and Mental Health Collaboration Program grantee this year. So can I ask Scott Ellington to tell us a little bit about himself and the Second Judicial District?
Sure. So we're much smaller. We're very rural. I'm the DA in 6 counties actually, and have deputies in each of the counties. Mississippi County is our newest project, and we have about 43,000 residents in the county, and so it's one of those situations where we serve a great number of people, and our situation for the most part is is after charges. Most of the time folks get arrested and then they come brought to our attention, and we push them, direct them toward mental health court if applicable. Once someone is arrested and they're screened at the jail, we do have that capability to have someone screened immediately upon arrest, and after they are within 6 hours or so, we have a contract with the mental health provider in our district that makes rounds to the jail. If they qualify, or if there are family members that make us aware of issues, and quite frankly, most of the law enforcement officers know many times these folks are repeated customers, and they know who needs to have some mental health, who has mental health issues and would be directed toward mental health court. So that's who we serve is generally. I tell a story often that I was not somebody when this first started 10 years ago that was interested in starting the project, but one of my sheriffs actually brought it to me and said, "Look, we need to do this." It was his idea. He'd been to a sheriff's conference and heard the presentation. But bottom line is to make room in his jail, to get the folks that he continually arrests 3 and 4 times a year, 10 times a year, get them some mental health services. And so that's our premises, and we have criteria to bring folks in. We do all misdemeanors, and actually the only felonies that we don't accept are homicides and sexual assaults. Other than that, many times, if it's domestic batteries, that's a criteria that many exclude. But we find that a lot of times that family members who are or household members want the individual to get mental health help, and they want to repair that. So we use the mental health courts and our process to bring them back in and have that opportunity for them to serve. We have once they go to court, we meet weekly. We have a staffing beforehand, and each of the participants actually has a checks in every single day with their mental health provider, their representative in mental health court, so that they are checked. And so many times it's a matter of finances to make sure that they've taken their pills, and we can go into more detail later as how I think it benefits financially our counties in the district.
Great, thank you, Scott. I'm going to start with a question for all three of you. First, why do you think prosecutors should get involved with prosecutor-led diversion? It's not the usual thing one thinks of when one becomes a prosecutor. Why should somebody make the extra effort? Kent, can I start with you?
Sure. I think what we've discovered certainly over the years is that that people afflicted with mental health, either a long-term mental health situation or who are engaged in mental health crises, often have engagement with law enforcement, and those engagements are generally not either predictable nor productive in terms of what the outcome of it ultimately is. And so what we've learned over the years is we're not doing right by the individuals to employ the traditional criminal justice system tools, and we're also not doing right by the community at large by trying that approach either. And it's better, we think, in the majority of these cases, to employ much more of a public health approach toward individuals in these situations, and we actually think that makes the community overall safer as well.
Great, that's really helpful to hear that connection between public health and public safety from your perspective. Scott, is there anything else you would add as an elected prosecutor about why prosecutors should look into doing these programs?
Well, I think that you will make elected prosecutors should learn that they will make friends with their sheriffs pretty quickly if they can free up bed space. And one way to do that is having if we put folks through the process, and if they qualify for mental health court and they're meeting weekly with the mental health court, daily with a counselor or advisor, and not out wreaking havoc and getting arrested, that frees up bed space. And also when an individual is incarcerated, the sheriff's department or the jail is responsible for medical expenses. And when the sheriff that talked me into this, he was telling me that what sold him was the opportunity to get out of buying psychotropic medication, which is very expensive to him, and getting folks out, letting them provide their own medication, get their Medicaid and things paid, so that they're not. So you're freeing up bed space, and you're also alleviating the cost, pharmaceutical cost to the jail. And then again, like I said, family members and those people that are affiliated, that are innocent bystanders of this mental issue that their loved one has, they appreciate that so much as well.
Great, thank you, Scott. I think between those two perspectives, there are some very different but compelling reasons that prosecutors should be involved with this work. Bob, is there anything else you would want to add, either from your own experience or from the communities you've worked with around the country, in terms of why prosecutors should take on this work?
Yes, Scott's observation about the experience of police officers and other law enforcement on the street. I mean, they're in contact with these individuals almost every day. When you look at the capacity of a jail to actually provide mental health treatment, they do that because of certain constitutional obligations that they have. But we're trying to ask a system that was not really designed to provide mental health treatment to individuals. And then we're surprised that, they say insanity is doing the same thing over and over again and expecting a different result. All we end up with is, with these individuals, if we don't intervene in the mental health and behavioral health issues that they have, they're almost destined to come back to the system. And we, when you knock your head against the wall enough times and you realize you're not getting the kind of results you want, if you're an office like John Chisholm's office in Milwaukee, and Kent and Jeff, I should point out, Milwaukee is probably the most advanced office in the country in terms of the kinds of programming and thinking they're doing in this area. And that's one of the reasons we named them Prosecutor-led Diversion Mentor Site during the life of the grant. Everybody knows that mental health treatment in jail is not good, is not ideal. They try, but it's just not ideal. Outpatient treatment should be where we should be looking, as long as we can ensure that it's effective and it's safe. And it is clearly, as Scott has mentioned, the jail saves incarceration costs. The involved prosecutors entity saves time for more serious cases that they should be spending that time on. The research shows that this is effective. It's just a better way of doing business in terms of providing justice and public safety.
Hey, thanks, Bob. I'll go back, starting with Scott. One of the things that's different about prosecutor-led behavioral health diversion, this is not criminal court as usual. You need additional information in order to figure out whether someone is appropriate for your program. What sort of additional information do you get to help inform those decisions about who participates and who doesn't?
Well, we get information from the police officer of the sort of crime that was committed, what was brought the individual into jail, and then we have a mental health screener that reports to the jail within hours to screen the person. We also have the historical. So many times, as Bob said, the historical knowledge of who this person is and how many times they've been in jail already. So so many times, like I tell prosecutors all the time, what we're trying to do is there's a certain group of folks in every community that's basically doing a life sentence 30 days at a time. They go to jail, they serve their 30 days on their misdemeanor, whatever they did, get out, and then they get off their medication and reoffend, and then they go right back into jail. So the information that we provide, our mental health partners help us a great deal. They bring in, they contact family members as well. We contact family members. We have victim contact as well, and so many times it's the same people, but not always. And so those are our basic screening factors with the mental health screening that goes on, and then the offense, and then just the historical data of who this person is and where they've been.
Great, thank you. Jeff, can you talk a little bit about what kind of information you gather to make decisions in Milwaukee County? You have a number of different programs. I imagine you're using a bunch of different information to figure out who's going to be appropriate for what. Can you tell us a little bit about how you've put that together?
Sure. We have been very fortunate in Milwaukee to build a system of universal screening to allow just about everybody that gets booked into our jail to get the benefit of a initial screen to try to identify low-risk individuals. And for that, we use the LSIR-SV, which is the Level of Service Inventory Revised Screener version. It's a series of no more than, I think, 10 questions that allows us to identify those that might be low risk and might be appropriate for pre-charge diversion. In addition, to try to brief jail mental health screen, which is 8 questions that identifies individuals' risk or prior diagnosis of severe and persistent mental health issues. And we use that to try to identify ongoing treatment, ongoing resources in the community, and if those are not in place, to try to work with our in-house professionals to put that plan together. For those individuals that screen out as higher than low risk, we then use a full LSIR, or level of service inventory revised screen, which is much longer and identifies really not only what their prior criminal history is, but it also identifies what their main areas of criminogenic need and criminogenic risk are. And we use that to develop longer-term plans and make determinations about whether they're appropriate for deferred prosecution or perhaps a longer-term deferred prosecution through one of our specialty courts like drug treatment court or veterans treatment court. We also have developed or are continuing to develop a mental health treatment court similar to what Mr. Ellington is describing. Ours is very much still in a pilot phase, but again, that allows us to have more in-depth screening and psychological evaluations done to gather as much information as we can about what individuals' prior diagnoses are and what treatment they need. And we use this information to not only develop or make determinations about diversion or deferred pros, we also use it to make determinations about release and what appropriate conditions of release need to be put into place. And it usually revolves around treatment and drug testing. So I think the key is there are a number of screens out there. We are continuing to work to validate those screens in Milwaukee County, and we have been able to do that with regard to some of these tools.
Great, thank you, Jeff. And I just, as a matter of terminology, I just wanted to clarify that a screen is usually a relatively short standard questionnaire that essentially helps you say yes, no mental illness, yes, no low risk, which could then be followed by a more in-depth assessment that would give you more information that could drive a treatment or a case plan. So when these different programs are talking about screens they have in place, the idea is that these would be implemented regularly so that every person, we get a quick yes, no, and can figure out whether additional assessment would be appropriate. Bob, is there anything else you would want to add in terms of the sort of information prosecutors should be trying to get in order to inform their decision-making about prosecutor-led behavioral health diversion?
Yes, I agree essentially with everything that Scott and Jeff had provided, but would add this. Many of these behavioral health interventions, whether it be a mental health court or a prosecutor-led diversion behavioral health approach, rely on partnerships that can include everyone, including the public defender or the defense attorney in the case. And the reason those collaborations are so important is many times the victims are family members of the offender. They're not in a position to easily provide information unless the attorney involved in the case is willing to provide it. So when you talk about psychosocial history, usually the defense has much more access to that information because of their contact and representation of the defendant. And if you can build cooperative agreements with defense counsel, it gives you a whole new category of information to help decide whether a person is appropriate for this kind of intervention as opposed to just doing regular criminal justice. So think about where are those sources, how can you get them, work through the issues, the privacy and HIP issues that might be involved. The best way to do that is to simply build your partnerships out. I think the point of all of this is you're trying to develop all of the best information you can to make an appropriate decision. And the earlier you can develop that information and make it, the better. Part of the reason why some of these cases languish for so long is you're trying to work through the process of getting that information. That's the enemy on the timeline that we were talking about.
Great, thanks, Bob. Jeff, I'm going to turn to you. So you guys do this all by yourself, right? I'm just kidding, obviously. Who do you work with in Milwaukee County to do this work?
Yeah, and again, because we've worked so hard over the last 14 years of John's administration to build this collaboration, we've been very aggressive in seeking grants, in using justice reinvestment money to try to show our county board how economical and efficient and frankly equitable this work can be done. So I mentioned we have screeners in our jail that are funded. They're our pretrial services agency, but they're funded separately just to do both a bail screening in addition to risk screening in our jail. Through a grant that our chief deputy was instrumental in getting with the MacArthur Foundation, we have a full-time behavioral health specialist that is housed in our jail that helps us identify those with severe and persistent mental health issues, uses the brief jail mental health screen, and is able to overcome some of the HIPAA and other issues that we run into as prosecutors by getting releases from individuals to access behavioral health information. So that individual on a daily basis is working with our early intervention prosecutors to try to identify those that are appropriate for mental health diversion or deferred pros, get them out of custody with a release plan, and sometimes an actual handoff to existing case management, or if existing case management is not in place, to try to put that into place in a relatively short period of time. The other key partnership, as we all know in dealing with this population, is housing. That is an ongoing struggle and a challenge for this population, and so we work very closely with our Milwaukee Housing Division to try to find housing for those that have been displaced or are homeless. I mean, we talk about the importance of family in these types of cases, and it's absolutely true that they ultimately are not oftentimes interested in prosecution. They're interested in their family member or their friend getting the help that they need. And this collaboration of behavioral health specialists, case management, and housing really helps make a connection with family members that are willing to try to take care of those with these mental health conditions, but just need a little more help to maintain medication regimen and stability. So, yeah, you really truly have to build a collaboration. And the reason that we've been so active in this area is that we don't have a lot of police-led diversion in Milwaukee. It's an area that we would like to expand upon, but without our police departments actively engaging in pre-arrest or even post-arrest diversion, we find ourselves doing a lot of it once they are brought into custody or referred into our office.
Great. Thank you, Jeff. Scott, do we have your audio? Are you able to? Okay, great. Can you talk a little bit about your key partners in the Second Judicial District?
Well, we have a local mental health catchment area. We have a mental health facility that handles the 6 counties, and so Mid-South Health is our partner in this, and they are also our grant applier, and we've used all the grants that we can and continue to renew, and we do training, and we've been observed by other courts as well. We're not model necessarily, but we're how folks try to get started. when we started about 10 years ago, like I said, a sheriff came to me and with the mental health provider and service provider, and we had to go recruit a judge because we do mental health court, so those are generally judge-led, but so much of it is deals with the prosecutor's office to start with, is who we agree to put in the program. And recruiting a judge was it took a minute, but we were able to find a good judge, and his successor now has taken over the docket. But then getting the public defenders on board, that was another challenge, and you know, so many times the public defenders, you know, they would prefer not. They want to get a case over with as quick as possible or delay it forever. And our mental health court is set up on a schedule, and so once we finally got a couple of folks involved in it and committed to it and sold on the idea, they are great advocates, and quite frankly, they're during the staffing sessions, they're as stern as I am and my deputies are as far as meting out sanctions or things like that, because we have it is for the good of the participant and public safety as well, and good for the community. I saw one of the questions that asked about how we deal with restitution in such cases, and you know, one of the things that our mental health provider, one of their jobs is not only meeting with these folks daily. They actively look for housing in this area. They actively help them apply for or reinstate their Medicaid if that's possible, if they have that. But they also assist them in getting jobs. We have people that work in fast food, and of course this was before the pandemic, but we were getting people involved in working at McDonald's or Burger King or something, if whatever was in their skill set, and the pride that these folks have once they are able to have a check so that they can, and we make them pay the restitution. I mean, that's one of the requirements, and that helps them get through that. But so we have the judge, the mental health providers, the public defenders. Those are our key partners in this group that we work together along with my office.
Great, thank you. And it seems clear that the prosecutor is necessary but not sufficient to make these efforts work. Bob, is there anything else you would add about partnership, what prosecutors can do to cultivate partnerships, or anything else on this question that you'd want to add from your perspective?
Yeah, a couple things. Jeff has talked quite a bit about the use of validated risks and needs assessment tools to guide their work. In the early days of diversion, oftentimes the things that were driving it was simply some exclusion or inclusion factors, like if the person committed a violent felony, they were out. If they committed a first time minor misdemeanor, they were in, those kinds of things. Eventually, as the field developed, there was a growing idea of having kind of these tools to assess individuals and try to predict the effectiveness of this approach as opposed to traditional. And then finally, we're now to a more mature time, I think, in the field when offices like Jeff, their risk and needs assessment tools have been validated by researchers. So an important part of the partnership probably should include a research partner to your effort. And BJA, I actually am involved in another effort. BJA and Michigan State University run the Researcher Practitioner Innovation Suite Academy. It's quite a mouthful, but long story short, trying to help criminal justice professionals work more effectively with researchers. So you may need a researcher to help you validate your tools and then develop measures to test whether you're accomplishing what your goals and objectives are. research is very important in this area because I think it facts and evidence have a way of convincing people that you're doing the right thing, and it also gives you an opportunity to adjust or change the way you are implementing your program based on what the facts and what the evidence are telling you.
Allie, can I throw in something?
Sure, go ahead, Scott.
We also, listening to Bob reminded me, we have a local university, and that we contacted their statistics department, and the university has sent a graduate student to, and he is a member of our team, and it completely escaped my mind because I wasn't thinking that way, but he actually is our stats. He keeps statistics and keeps those numbers, and it is very important, especially when you're applying to renew grants or to get additional funding sources and things like that. So that's one of the sources that he just sits over there and doesn't have a lot to say a lot of times, but we get a printout monthly with sanctions and completions, and he has just carte blanche of the information that he can gather from our sources pertaining to these folks. He's signed a non-disclosure agreement, and it's the confidentiality agreement with this. But and he, in our contract, we agree. We have the participants to agree that their information is gathered for statistical purposes and record keeping, and it just escaped my mind. But it's a very important, and since we are a small area, we don't have maybe all the resources that Milwaukee would have, but our local college is willing to assign a grad student for this every year, and it's kind of an ongoing project that they have as well.
That's wonderful. Thanks so much for adding that. I wanted to get into one of the questions that I feel like is at the heart of a lot of questions we get about behavioral health diversion, which is just, does it create a public safety risk? And as prosecutors, how do you have comfort that these programs are the right thing for your communities? What do you do so that you understand the risks, can mitigate them, can manage them? And I'll put that first to Kent and then go over to Scott.
Well, the partnerships with others who are experts in the field are critical. Clearly, the partnership we have with our behavioral health division in having that liaison embedded in the jail and being able to gather sensitive information and then conduct a handoff directly back to the mental health service community is vital, because, of course, what that does is it eliminates all of the searching we were trying to do and the difficulty with trying to figure out what a person was eligible for, what a person might already be engaged with, what the best course of future action might be for a particular individual. So that's really helpful. I think most people understand, and when they're told that the vast majority of people who are afflicted with either a long-term persistent mental illness or are simply in a mental health crisis and having some engagement with law enforcement, the vast majority of people are not engaged at a high level of violence at the time and are not violent offenders per se, as we might classify them in the criminal justice system or by law enforcement. And many people, I think many of us can relate to it. If we have loved ones or we have friends who might battle some sort of mental illness or crisis at one time or another in their lives, a lot of people can relate to this actually, and are looking for, more of a health solution to this before something gets too difficult or before it rises to the level of somebody getting hurt. I think that's certainly what we hear from families and the members of our community all across Milwaukee County. In fact, we hear from law enforcement. The reality is that I've done training with law enforcement over the years, and they're asking what can they do besides putting handcuffs on somebody who's in a crisis. And when you have your own police agencies asking for that assistance from the other communities, the other sectors in a community, the medical community, the mental health community, then we ought to listen to that, because what they're saying is we're not best equipped to solve this problem, and and we'd like those who are to really step into this arena. I do think it's important to note that increasingly police agencies, I think, are looking for those types of partnerships as well, and we've been lucky that certainly in Milwaukee, our largest department, the Milwaukee Police Department, has engaged in what we call a crisis intervention team, meaning officers. They have two teams, officers with mental health clinicians who go out and respond to calls right there in the community each and every day. Our largest suburb now has one of those teams set up as well. So you have officer paired with clinician to try to come up with a medical solution to someone in crisis, rather than putting the handcuffs and taking to jail somebody who really otherwise doesn't need to be there, perhaps. Our sheriff's department with countywide jurisdiction has just engaged with our behavioral health division to set up one of these teams as well. And so again, I think that the more we confront the reality of how difficult these situations are, but yet how widespread mental health issues are in any community, and how if we can be more, I think, transparent and honest about what these really look like at the end of the day, we are much more likely to have the buy-in from the community, because they see sectors across lines of medical and police and law enforcement and prosecution all working together toward really trying to problem solve, rather than simply trying to react and then later point the fingers at one another if something doesn't go as well as we hoped it would.
Great,
reality,
thank you, Ken. Oh, sorry.
Just add one more thing, that Jeff's program that he's designed with regard to the diversion and the pretrial deferred prosecution agreements actually, in a lot of ways, offer more supervision than our corrections department is able to add at the end when someone is put on probation. So that goes back to the ability to point out to people that, look, if we can get somebody with an intense amount of supervision now to incentivize engagement with the services that will actually help them, we can do that more quickly, we can actually avoid taking someone through an entire criminal justice system process that may not actually achieve much, that may actually achieve a lower level of supervision after everybody's stumbled through months and months in the judicial system. And in particular right now with the COVID pandemic and how that slowed things down, a faster response to these crises is actually more beneficial to everyone.
Great, thank you. Scott, you've run for election in your district. Anything else you would add about how you have comfort that you're mitigating and managing public safety risk?
Well, like I mentioned earlier, our program, the very beginning of it was from a sheriff, and our local law enforcement participate. They so many times before the mental health provider gets us the report that to bring somebody in, we'll be contacted by the person who arrested them, the officer who arrested them, and said, this is somebody. We have that, and then just like Kent and Jeff said, that the daily the checking in, there's much more supervision from the beginning, and keeping them supervised and keeping the folks taking their medication, getting a job, going to their day group meetings or their night group meetings, and if they are actually working in a fast food or whatever, they still have to show their face or make a phone call and be touched, have check in with our providers. So we are, and also the relationships that our team members have, the public defenders and the mental health professionals, the relationships that they have with the participants' families. So many times they tell us if we don't know it already, and if they don't see it through the program, if they say they're messing up over the weekend, or there is we get that information from family members so many times, because once the improvement starts, they don't want it. The family members don't want it to stop. So if somebody's fixing to go off the rails, we a lot of times get a heads up about that.
Okay, thanks, Scott. Bob, anything else you would want to add about the true risks these programs pose, or how you've seen prosecutors reduce the risk to public safety through their diversion programs?
Yes, and it really goes to Kent's point, I think. The research is pretty clear that these individuals suffering from behavioral health issues generally are not high-risk violent offenders. One of the projects that we are collaborating with you on is this fact sheet on what I call the myth of mental health dangerousness. If an individual presents as one of those kinds of risks, you usually see it in their history. I mean, prior assaultive behavior, violent outbursts, threats, things of that nature. The good news is that population is relatively small in size in the grand scheme of things when you talk about people with behavioral health issues. The vast majority of people struggling with mental health and behavioral health issues are more likely to be crime victims. And there's research that suggests that they may be 10 times more likely than average to actually be a victim of a crime as opposed to a perpetrator. So I think, again, when you get back to what the evidence says, you can rest assured that if you are running effective programs and doing effective screening, that you reduce the likelihood of anything going badly in terms of an outcome. And I think that's borne out by the experience of mental health courts and diversion projects across the country for decades. I remember very distinctly these concerns about, well, what happens if the person gets put on one of these programs and goes out and commits a case that ends up in the headlines? No one wants that. The prosecutors are always concerned about public safety first and foremost, I think, in their obligations and in their role. But if we just jam these cases through the traditional criminal justice system and they come out with no treatment, no supervision, something tells me that the likelihood of something bad happening is even greater than trying to develop new and innovative ways of trying to deal with them. So I think both from the standpoint of what the research says about such risks and what our experience has been over, for all the concern we had about what happens if something bad happens, it generally doesn't occur. And I think that's the experience in most jurisdictions.
Hallie, can I add something on there? Is that, most of the time they come into our court, our mental health court, under property crimes, things like that, less violent offenses. So if they committed a violent offense, then we'll prosecute them for that, and we'll go through the procedure that we normally would. However, I think our population knows, most people know that there's just a certain group of folks that have mental problems that they find themselves in trouble over and over again, and it's because of their mental illness. And so I think that the population, the folks, are more understanding and appreciate the opportunity or the mental health court program than when they hear about it than you would think, and that politicians fear.
Great, thank you. I think there are a couple of really important points we heard here about how these programs can really do a lot to improve individuals' well-being and health, improve public safety. It's important to have a crisis plan in place, but you probably will not have to use it, or it's unlikely you'll need to use it. And just to Bob's point, that the research really does show us how few people with mental illnesses are involved with violent crime. And we do have this FAQ coming out, and one of the articles cited, which is about mental illness and stigma associated relating to violence, the researchers are just sort of incredulous that after all of this research, people seem to still be walking around with this idea in their head. which just is not borne out. So thank you all for that. I'm going to, before we go into the audience questions, I wanted to go across our panelists, just any final advice or tips you have for other prosecutors who are either working on diversion programs or looking to start a diversion program. And I'll start with Scott in terms of general pearls of wisdom.
Well, my only advice is if you're thinking about starting one, perfection is the enemy of progress, and you're not going to get it right the first time. The BJA grants and things like that. There's great guidance there. May not be smooth for a year, but don't hesitate. I think that it is very important to your community and to those folks that we serve and their family members. That, I mean, yes, we could lock them up for a few days or 30 days or 90 days, but what good does that do if you can save them from doing that life sentence 30 days at a time, and also you save your jail great expense, and I'm a fan.
Great, thank you, Scott. Jeff and Kent in Milwaukee, any general advice or tips from your work?
Well, I would certainly echo what Mr. Ellington said about, right, you got to start somewhere, and certainly there is a lot of information that is now available on a national level that allows you to look at best practices and helps you kind of formulate what your program could look like or might look like. But so much of this work is really trying to just start doing something. The other thing I will say is we've been fortunate, and again, you don't always hear prosecutors talk about collaboration with public defenders, but we've been fortunate in our jurisdiction to build this program from the ground up with the help of the Public Defender's Office. They have dedicated a team of attorneys that work with my team of attorneys to try to identify those that are appropriate for early intervention, diversion, mental health, or otherwise. So, but if there are certainly other partners in your community that are well versed in working with the mentally ill, those that are drug addicted, or certainly suffer from dual diagnosis in both those areas. They do the work every day, and they are always looking to collaborate with the criminal justice population. So early on, we had little to no funding to do any of this work, and we just started doing it and formed partnerships with those entities within our community as well as the defense bar to do the work. So I think those are helpful things for you to keep in mind as you build a program.
Great, thank you. Kent?
Well, I'd say even with the best of partnerships and resources and ideas, it's still an imperfect process. There's just no question about that, and there can be things that impede progress in certain cases, so while we do have good relationships with all of our community partners, there are times still that we have frustrations over cases where we feel like we can only do so much, and we're willing and asking for something different to be done outside the criminal justice system, and we find that our partners say that their hands are tied as well. So I want to make it clear that we have, as much as we have a lot of collaboration in our community, we have big city challenges here too, for being a small city in some ways, and so but at the same time, it's again persevering through those cases where we think there ought to be a solution and there apparently is not one, toward understanding that if you can still improve the overall landscape for many people, that may not simply, that collaboration may simply not exist in every single case.
Yeah, that makes sense. Bob, any final sort of general words before I get into the questions from the audience?
Sure. I kind of just leave our audience with, the Justice, and it's been said that the justice and fairness of a society can be gauged by how it treats its least powerful members. And I think it's pretty clear that people who suffer from behavioral health issues, that's a malady that's not their fault. It's something that is a health-related issue as opposed to a criminal justice issue. And so how we treat people who present in the criminal justice system with these issues is it's a gauge for our own commitment to the ideas of justice and fairness. And again, going back to the research, disproportionate numbers, and this is one of the topics of the fact sheet, that the jail populations of our country present, the jail population is disproportionately includes people who are suffering from significant mental health issues. So I think in the grand picture, doing things to advance public safety and individual well-being is what we should be in the business of. And so I laud all the efforts of people like Scott and John and Kent and Jeff and their other colleagues in the field who sometimes they go out on a limb to try to make the system more effective for people.
Yeah, absolutely. So I'm going to show you a couple of the takeaways from our conversation. When we sort of had a pre-conversation with the panelists, these were some of the highlights, that most people with behavioral health conditions are not coming to jail for violent offenses, that these programs can actually increase the overall safety while saving jail costs, the importance of universal screens and comprehensive assessment, the relationship between one's risk of recidivism and the amount of supervision, and if that's a new concept, we have lots of resources on the risk-need responsivity model, which can talk a little bit more about that, the importance of collaboration across partners in order to make behavioral health diversion work, and perfection being the enemy of progress in this area. We're going to do about 10 minutes of question and answer. You have a Q&A box in the WebEx panel, and folks have been sending them in fast and furious throughout. So I'll start dealing them out to our panelists. Please type in your questions, and if we don't have a chance to answer your question, still type it in so we know it's something you're interested in. You know, the questions we hear from the field are what helps us develop technical assistance and training for the future. So your question is probably a question someone else has, and we would love to be able to answer it. I have one general question, and I'm going to start this one to Scott, but I'm hoping Kent and Jeff will be able to chime in as well. And this is about the politics of behavioral health, of starting a diversion program. And the questioner says, I strongly support diversion ideas and it makes sense, but sometimes politics get in the way. What barriers, especially political, impede adoption and successful implementation, and how have you overcome those? So, Scott, do you have any questions there about the political, comments there about political barriers? Then we'll go over to Jeff and Kent and Bob again for cleanup.
Well, first of all, it's one of those things that in our society, if you have the dollars and cents, and that's what I started out with, is if you're saving the county or saving the jail money, many people are in favor of that, and how can you do that? And so we are saving local resources, and that's just a big step. And as far as the other part of the politics of it, you know, sometimes you just got to man up and do what you got to do. This was something, again, when I started, it wasn't on my radar, but I began to feel like it was presented to me by a sheriff, and the most powerful person in the county sometimes is the sheriff. And so I got his endorsement, and then we've actually carried it to 3 other counties in my 6-county district. The other 2 counties are very small, and so we bring their participants in. And sometimes there's a little heat that can be had, but we just deal with it.
Okay, thank you. Jeff, Kent, in Milwaukee?
Well, I think that we, similar to what Scott just said, I think we, at the end of the day, you make the case for why we're doing what we're doing. The fact of the matter is most law enforcement agencies are supportive of that, so that helps in terms of blunting where you could see criticism from some circles who may say we're not being tough enough on crime. The reality is a long time ago in our office, we tried to draw a line between those individuals who were threats to other people and those individuals who primarily threats to themselves, and whose behavior was often born out of something other than the desire to hurt someone else. And when we do that, that's led to a lot of the diversion programs and the treatment programs. And the reality is we've seen a lot of receptivity to that. That hasn't translated to more funding for the office, or I don't think we've seen realistically the savings we've achieved for our local and state governments have not been returned in other ways like we would hope in the quintessential form of justice reinvestment. And so I would say that's probably where the politics come in at some point. We make the case for it. We can make the showing of the dollars saved, and we can say this is where it should go to more treatment or more things like that would assist those who could use it and could benefit from it and could make us all safer by engaging with it. And we don't see that. So that's where I think the politics comes into play, probably more than being an impediment to the work we want to do as the prosecutor's office.
Great, thank you. Bob, anything else on politics? Okay. Bob, I'm not sure if you're... Okay.
Sorry. Evaluation's critical to the politics discussion. There are basic criminal justice facts that, once discovered, can settle policy disputes. And there's a long history of research now showing the effectiveness of diversion. You can look at the NIJ studies. You can look at some of the work we did in the Prosecutor-led and the mental health courts and drug courts. If you can show that you get better outcomes through diversion than you do from traditional criminal justice, it's pretty hard to argue against.
Great, thanks, Bob. I have a couple of questions that I'm going to clump together for the team from Milwaukee. The first is around how you remain compliant with the Victims' Rights Act when diverting cases.
Yeah, this is Jeff. As I alluded to, in every single one of these cases that is a victim, we not only do the assessment and look at the criminal history and determine if the offense excludes, but we consult with the victim. And oftentimes, especially when, as Kent alluded to, the victims are family or friends, they are very supportive of us trying to do something other than traditional prosecution. But we certainly have victims that have been traumatized that are not completely initially on board with the concept. But the more you start talking to them about, especially if restitution is involved, the ability that an individual defendant would have to pay back restitution if they were allowed to participate in a program like this. Most victims ultimately want accountability, and this program provides that, and we show that to the victims via the agreement. We share the agreement with the victim. We give them the opportunity to talk to us about any additional conditions. We typically will include apologies. We even do some community conference restorative justice in some of these agreements to give the victim who wants to participate an opportunity to have a face-to-face under very controlled circumstances with the offender. So these are all techniques that we use to meaningfully consult with the victim. And ultimately, if the victim is adamantly opposed to an individual participating in a program like this, we will listen very, very carefully. And sometimes that's enough to convince us not to make an offer of diversion or deferred pros. But we certainly never, ever fail to consult with the victim as required by the victim rights law.
Thank you. Another difficult question, I think. There are a couple of questions about how you administer your risk assessment tools and, the very live conversation going on right now about potential racial bias in the way risk assessment tools are developed or administered. I was hoping either Kent or Jeff could talk a little bit, first just operationally who administers the LSIR short screen version, and then also how your team has thought about race as it regards risk assessment, or risk assessment as it regards race.
Yeah, this is Jeff. All of our in-house screens are administered by a organization called Justice Point. They are funded by Milwaukee County in a collaboration with our Community Justice Resource Council, and they are pretrial specialists. So they are pretrial officers that contract with the county, and we have a good working relationship with them. Our office does, the public defender's office does, the courts do, and they have a lot of legitimacy and trust. And so we have great confidence in their administration of the assessments, and then the results of the assessments are available via our inter-office servers to all of those entities, the defense, the courts. And clearly, if we have questions or concerns, we go back and we talk through with them. With regard to the racial disparity, there is no doubt that we, like jurisdictions across the country, are concerned about the use of risk assessment and racial disparity. And I think that's an ongoing conversation. We even have had conversations about potentially changing some of our cut points with the use of some of these risk assessments to factor in individuals that are people of color. But again, my other response to that is we certainly were doing really, really horribly on the racial disparity issue before we started using any type of assessment and collecting the results of that. By using an assessment and keeping the data, we can continually look at, as we do, the demographics of our program and who we're admitting and who we're not admitting, and trying to level the playing field, so to speak. So I can tell you that with regard to our pre-charge diversion, it is predominantly people of color that are put into that program. With regard to our drug treatment court, given the heroin epidemic in Milwaukee and throughout the country, that population tends to be skewing a lot more Caucasian. So, but the bottom line is we know we can look at this data, we can measure ourselves, and we can make adjustments. And I would argue that the use of risk assessment and the capturing of that data allows us to do that. If we didn't do this, and if we went back to just professional discretion, we weren't doing very well on the racial disparity issue by just relying on that either.
Okay, thank you for handling a really complex issue so succinctly. As we're near the end of our time together, I wanted to just show you here, these are some of the studies that were used to support these statements earlier in the presentation about the advantages of prosecutor-led diversion. So if you want to read yourself or provide for somebody else, the research that the panelists have been alluding to. Here it is. Also, as Bob mentioned, we will be releasing in partnership, CSG Justice Center as well as the Association of Prosecuting Attorneys will be releasing a fact sheet on frequently asked questions about prosecutor-led behavioral health diversion. So that will be coming soon, and we hope that that'll help you all in the work that you're doing. I wanted to give a big thank you to our panelists, Kent, Jeff, Scott, our partners at the Association of Prosecuting Attorneys, Bob and Marlene, as well as big thanks to my own colleagues, Rachel and Eunice, who have been working behind the scenes to make this webinar go smoothly. Thank you all for joining us. Wishing you all a safe and healthy Friday and weekend ahead. Thank you all very much. Here's the information if you'd like to contact us with additional questions or suggestions and sign up for our newsletter. Have a good weekend.